trust in me. My eyes wouldn't lie, eyes wouldn't lie to you. Over and out, I'm taking chances. Over and out, dead in the bad days. Over and out, your eyes they light the way. Over and out, we'll never be done. Riding around town, me and her now, under the city lights. She shines big when I look at her, that's why she's my bright eyes. Why she's my bright eyes. Why she's my bright eyes. Why she's my bright eyes.
This is just the beginning.
Hi, welcome to Health Equity in the Next 4 Years. I'm Caitlin Owens, healthcare reporter and author of Axios Vitals, our daily healthcare newsletter. I'm joining you from my home in Washington, D.C. Thank you to USA Facts for making today's event possible, and welcome to all of our audiences joining us on Facebook, YouTube, Twitter, LinkedIn, and from Axios.com. You can follow along with today's conversation at #AxiosEvents or at Axios on Twitter. Over the next 45 minutes, we'll unpack how the pandemic has changed the trajectory of healthcare and what is expected to happen over the next 4 years. Our first guest here today to start unpacking this question with us is Dr. Robert Blendon, a public health professor and professor of health policy and emeritus of the Harvard T.H. Chan School of Public Health. He's joining us from Boca Raton. Welcome, Dr. Blendon.
Thank you for having me, Caitlin.
Let's jump right in and start talking about obviously, the number one health topic right now is the coronavirus. And let's talk about equity and disparities. And can you just kind of outline what are the best things we could do from a policy perspective to help reduce the pain of the pandemic and to reduce the inequities associated with it over the next few months?
First, I want to be very cautious here. Unless a number of things are done on a near emergency basis in the next 6 months, a lot of Black and Hispanic Americans are going to die. So there are a lot of things we can do about race and equity that are really very, very important over the next 4 years. But I am very worried about the next 6 months. And so at the moment, Black Americans and Latino Americans are dying from this virus at a much higher rate. And so if you just said, we got to get people through the next 6 months, what would I focus on? And there are really 4 things. First is, one of the reasons why they're dying at such high rates is that they have existing chronic illnesses, diabetes, heart disease, asthma in particular. And so if they are infected, they are much higher risk of dying from that infection than many other people. So the issue is, do they have an adequate connection that if they have symptoms, they first start with telemedicine, and secondly, they can be referred and seen when the coughing starts or some other symptom, and they don't have to wait long times for that. And so the connections aren't there. These populations don't have the type of direct medical care relations, particularly in a short time period, that if you were at risk, your mom starts coughing and everything else, that you can get seen and get returned. And yes, testing helps out a lot, but we'll talk about that. That's not the only answer for people who are very high risk. So first is, secondly, this 2 communities are underinsured. If they do need care and they need advanced testing and they're going to be in ICU, there can be no question that their bills won't be paid. And so emergency coverage in the next 90 days or something would help enormously. And again, everybody wants to talk about 4 years, we have universal coverage. I am worried about people dying because we've entered the winter season. The cases loads are going up quite dramatically in multiple states. So I just want to be sure that these populations make it through the next 6 months for that. The third issue has to do with a survey we did with National Public Radio and Robert Wood Johnson Foundation. People don't put together that in this economic downturn and layoffs, essentially, Black and Hispanic Americans are having terrible financial problems today. And so what we found is that 72% of Latinos said, I have serious financial problems in households now. 60% of Black Americans, almost double that of white Americans. What does this actually mean? So 4 in 10 told us that they don't have any savings left. And then a quarter can't pay their mortgage, their utilities, their rent. Before that, that was when the federal aid was going on. So we have people who are hanging on by fingernails when there was federal aid, and there's no federal aid, and we're about to stop the limited protection that you can't be evicted if you can't pay your rent or utilities. And so, yes, we're all talking about 4 or 5 years and how we can make these structural changes, but we are going to increase the number of homeless Black and Latino Americans in 6 months unless there is emergency financial aid. And the problem for your audience to understand something that's happened with this outbreak, natural disasters in this country have not been political in previous years. When a level 5 storm hits the Gulf, we don't argue, is it a Republican drowning out there, a Democrat? We have gotten into this politically. So whether or not we help people or not in this emergency period has gotten to be a political issue where otherwise we're saying they're drowning. Send in relief, send in FEMA, feed people, get the tent set up so they don't die in this period. But we have politicized this for this. And the last is this promise of a vaccine is so exciting because at the moment, the public health experts say to you, we think we know what we have to do. We're going to shut the economy down in considerable amounts. For a lot of Americans living from paycheck to paycheck, that's not an ideal answer for them, but a vaccine is. But the problem we're going to face is, and people have to understand the broad history here, for Black Americans, and less so for Latino Americans, but for Black Americans, a lot of the news are saying, President Trump politicized this, and he did. But the issue for them is for more than a century, and a number of very thoughtful books have been published about this, Black Americans have been experimented on unethically by medical scientists. Tuskegee, but there's a whole list about giving drugs that are untested for this. So in the Black community, there's a history that these experts out of Washington with their white coat scientists have not been in our public interest. And many Latino communities have a different history of coming from countries where they use untested drugs. Some of them are quite dangerous for that. So when it's announced, we have something that could actually save your life and your mom and your dad and everything else, there's going to be a resistance for this. And there has to be a very sensitive effort in the next 5-6 months to convince groups who are suspicious of medical scientists and pharmaceutical companies that this is a way for them to stop dying disproportionately. But it won't be easy for it. So these are the things that I would move forward for, but my focus is the next 6 months.
Well, let's now talk politics. Let's start with the next 6 months, as you are most concerned about that, and then we can go beyond that into the next 4 years. Joe Biden is about to be president of the United States in a few months. He will then inherit the coronavirus pandemic. Between now and in that 6 month time frame, once he takes office, how do you see this kind of quest for equity playing out politically, and then once the pandemic is over, extending into the next 4 years?
All the political divisions in this country did not disappear with this election. Those of us who were much more nonpartisan wish they did. You have to understand, and for viewers, this hasn't been settled. The issue about who's in the majority in the Senate will be settled in Georgia with 2 seats. They're up for in a special election in the first weekend in January. There's some estimates passed that Republicans may win one of those seats. If they do, you have to understand that Republican senators were elected by voters who did not start their show with talking about equity. Equity is not a priority. What was a priority for them? Economic growth, open the schools, get the religious services back, make sure that we don't borrow ourselves into oblivion here. But achieving equity is not it for them. So in the Senate, the president-elect could find very substantial barriers. But I want to move the other side here. The president has enormous authority to move administratively in many areas. And for those of you who are not familiar with the election here, President-elect Biden would not have been president if it were not for Black voters, particularly in the primaries. The week before the South Carolina Democratic primary, major news sources talked about how Joe Biden's time had come and gone. And it didn't come and go because unbelievable Black numbers of voters came out South Carolina, Super Tuesday. And even though they were Black minority candidates, they voted for him because they thought he would do something about their deep structural problem. He will use every lever administratively to try to help the group out. But if you're a listener, if the Republicans hold the Senate, where you have to pay attention, if what he proposes involves billions of dollars of new spending, they're going to be very leery to do that. This is not their top priority. for that. Absolutely not, and they won't move it. Any administrative decision that he can make, overseeing agencies, priorities, public advertising, reaching out, emergency help for the uninsured, that he can do himself will be done because he has a debt here as well as an obligation. But we have not ended the politicalization of healthcare. This election did not resolve the fundamental differences about what government should and shouldn't be doing in the next 4 years.
Thank you so much, Dr. Blendon. I always love hearing your perspective on these issues. We are almost out of time, and so unfortunately, we're going to move on, or fortunately for maybe some of our listeners who want a lighter note here, to one fun thing. 20 seconds. How are you celebrating this very unusual Thanksgiving?
I take watching crowds very clearly. So we've agreed that we found a restaurant that has opened in a field, essentially, open air. And of course, in Florida, you can get away without wearing a winter coat. So we've decided we would go out wearing a mask, but in an open field. For that, everything else, we are, in fact, watching very carefully crowds, travel, because we're nervous about this. But we thought we could have one meal if it was out in the air and everybody was wearing masks. Best Thanksgiving to everybody listening.
Well, I hope you enjoy it, and it sounds like a very safe way to celebrate. So
Yes.
I'm excited for you in that Florida winter.
All right,
Dr.
and
Blendon,
thank you for having me.
thank you for joining. And for our viewers, up next, we have A View from the Top with Axios CEO and co-founder Jim Vandehei and founder of USA Facts, Steve Ballmer.
Thank you very much, Caitlin. It's now my pleasure, my honor to give you a conversation with Steve Ballmer, who's the founder of USA Facts. Steve, good to have you back here and good to have a conversation in this weird environment about facts and about things that really matter.
Well, pleasure, Jim. Thanks for having me back.
The thing about healthcare is it's such a huge part of the U.S. economy, a huge part of our lives on a daily basis. Let's break down some of the facts around it as we think about how do you fix the system. When you look at it, just talk broadly about spending. Like, how much do we spend and where do we spend that money when it comes to our healthcare?
Yeah, we spend about $3.1 trillion, which maybe is hard for people to think about, but here's a couple other ways. That's 15% of our GDP. You can think about it as one out of every 6 things, 1 out of 6.5 things we do or spend is healthcare related. Or you could think of it as $9,400 a year on average per capita, and obviously much less for some, much more for others. The thing that is crazy about it is that same number was about $3,100 inflation adjusted in 1980. So the amount of money we're spending has gone way up. Obviously, we have a lot more senior citizens as part of the driver. But whether it's hospital costs, doctor costs, people often focus in on prescription drugs, which is only about 10% actually, Jim, of healthcare costs. But we're driving it across the board.
And for most of us, we get our insurance through our provider. We pay for it ourselves. Talk about that landscape for how many people have insurance, and for those that do, where do they get it? And like, when you look at the numbers, is it enough to be able for the average person to be able to cover sort of those exploding costs that you just outlined?
Yeah, well, about 8% of people are uninsured, which is certainly down since 1990 when it was about 14%. It's ticked back up some over the last couple of years, probably the policy changes in the Trump administration. If you look at who's uninsured, certainly a piece of that's going to be undocumented immigrants who are not eligible for government plans. That's something that largely is omitted from the discussion about who's insured and who's not. That essentially is a government policy that does insure some uninsured folks. Most people are under a private plan, whether they bought it themselves or got it through their employer. That's about 68%. And then 34% of people are insured under some government plan, Medicare, Medicaid, veterans plans. It all adds up to more than 100 because a number of people are under multiple plans, particularly Medicare patients. So, and then if you look at what people pay, it really runs the gamut, both in terms of premium and the amount of copay and coinsurance that people need to put up. It is quite clear that for people who are in the bottom 40% of income, maybe even bottom 60%, an unexpected health problem could easily put people into deep debt or even a bankruptcy position.
You're a businessman. You own the Clippers, the basketball team. You ran Microsoft. You spent a lot of time thinking about return on investment. Are we getting a good return on our investment? We're spending so much on healthcare. It costs so much. Like, what's the end result? Is my healthcare in general, as an average citizen, that much better today than it would have been 5, 10, 20 years ago?
Well, you got to decide how you want to measure your healthcare. I don't think for me the relevant issue is how's my healthcare. I think the relevant issue for me is how's my health. Yeah. Is my health better? Am I living longer? And I don't like what I see there. The average age at which people die, which may be because I'm close to 65, is the number I look at as opposed to life expectancy. That number is about 73.2 years. But in 1999, so 20 years ago, that number was 72.4. Now you could say, oh, it's great. It's up 0.8 years. Or you could say, shoot, for that kind of investment in healthcare, even if it's all spent in the last year of life, all we're buying is 0.8 years? That's distressing. Look at heart disease. Now, heart disease continues to rise pretty dramatically. It's up 11% and almost 12% in the last 5 years. And 30 million Americans have heart disease issues. Obesity is a key driver of that. Child obesity is up. 26% of Hispanic children are obese. 14% of white children are obese. That only leads to bad health, lower life expectancy. The question I might say you got to ask is, at the end of the day, can our health care give us health, or is it our lifestyle and our habits?
And it really is a combination of both, right? And probably more the latter. I mean, the fact that I probably assess more about my health than my parents or my grandparents ever did. I think more about diet, more about working out, what I put into my body. I assume a lot of people are doing the same, and yet we've kind of flatlined in terms of, as you said, life expectancy. And is there not enough attention on that side of the equation in your mind? Like the self-ownership of our health?
I think so. I think so. There's some things in which the medical system does a pretty good job, where they say, hey, look, we're not going to give you a new knee, an artificial knee, unless you get your weight down, because it's not going to make any difference. But there's some things where I just say, hey, look, if you want to be entitled to insurance, you ought to also be required to put in some exercise, something that's going to keep you healthy. Obviously, that would be a thing that citizens through the democratic process would have to agree on. But if I was I used to write health insurance plans. Microsoft was self-insured. We decided what our healthcare plan was. And we actually paid people to go through diet programs if they were technically obese. It was a net saver of money for our company.
And as we wrap up, we can't talk about healthcare without talking about COVID. How worried are you about this latest surge and the strain that it's going to put on us as individuals, but the healthcare system as a whole?
Well, the explosion has been nothing short of stunning. Just stunning. We're running about 180,000 new COVID cases. We got a map here that shows how the COVID cases per capita keeps moving. We started in the east and the south, it moves to the west. And now, there literally are counties in North Dakota where 1 out of 5 people in the county have had COVID. So I'm very worried about it. I'm not an expert. I can't tell you when the vaccines are really coming. I personally am very conservative, if you will, in terms of protecting my health and my family's health. But, this hospital situation will be bad. And if you can save people, that's great. But if all you're doing is buying people some lack of stress by being able to put people on ventilators, I think we're really in a messy situation for the next 2-3 months anyway.
Steve, thank you for this conversation. Thank you to USA Facts for making this broader conversation, this broader fact-based conversation possible. Happy holidays and stay safe. And back to you, Caitlin.
Thanks a lot.
Thanks, Jim. Joining me now from New York City is Everett Cunningham, who's the president and CEO of GE Healthcare United States and Canada. Welcome, Everett.
Hello, Caitlin, and thanks for having me.
Thanks for being here. So one big storyline within the healthcare sector during the COVID pandemic has been technology, and just how new technologies have been enhanced and accelerated and created to deal with the virus. Can you talk about how just the available technology has changed from the first wave of the pandemic all the way back in March until now that we're facing the third wave of the pandemic?
Yeah, Caitlin, technology is one way that GE Healthcare has really partnered with our customers throughout the pandemic. And even actually before the pandemic, we knew that digital and technology and artificial intelligence and things like that would be a wave of healthcare, making health systems more efficient and more effective. And in a weird way, COVID-19 has actually accelerated the acceptance of technology around healthcare. A couple of great examples from GE Healthcare and how we're going about partnering differently with health systems is around making their health system much more intelligent and efficient in the way in which they take care of their patients. We have a tool that's called Command Center. Imagine, if you will, NASA and NASA and Mission Control and how they're looking at their business all in one room and they can see everything. Command Center is the exact same thing for hospitals and health systems. They are able to see a lot of their vitals in the hospital in kind of one room. And around COVID-19, health systems have been absolutely embracing this technology. One good example is Tampa General down in Florida. I've worked with their CEO, John Corris. He wanted to make sure that they took care of patients more efficiently, wanted to make sure that he cared for his clinicians so they didn't have to go from bedside to bedside. And so they adopted our Command Center. They rebranded it. They called it CareCom. And what they're seeing is not just the efficiency of the hospital improving, but bending the cost curve and bringing costs down, which is great.
Fun fact, I was born at Tampa General.
Right.
Little personal touch out of there. So one thing that I'm reading about all across the country is, two things actually. Hospitals are facing staff shortages, and they're also facing a huge number of just burnout among healthcare providers. How can technology help address those two issues?
Yeah, I'm glad you mentioned the word burnout. When people hear the word burnout, they sometimes think of physical burnout. And what we're seeing and hearing across the country and Canada is we're hearing mental burnout, right? People are we've been in this for 10 months. They're concerned about, their well-being physically and mentally. And how can digital and technology help? I think about, a tool that we have called Mural. Mural is a great tool. It takes a lot of the intensive care unit vitals. And instead of going from bedside to bedside as a clinician, looking at the vitals of the patient, again, it moves it more to a central located room to where they can see the vitals of those patients, right? Whether they're at that hospital or satellite hospitals in one room. And I think of a couple things. First of all, I think about the caring of clinicians around this burnout. They don't have to go bedside to bedside. That can be physically exhausting. It can be mentally exhausting in terms of, am I, increasing my chances to get infected? Not just from the clinician standpoint, but from the patient standpoint too. And we're doing this with hospitals around the country. We're doing it with OHSU in Portland. We're doing it with HCA in Florida. We're doing it in the province of Saskatchewan. And we're getting feedback that, it's really increasing the productivity of clinicians, but then also caring for them in terms of decreasing exposure, lowering PPE use, and things like that. And GE's really happy to partner in that space.
Right. And so, hopefully sooner rather than later, but one day this pandemic will be over. What do you see as being the lasting effects in the healthcare sector of some of these trends that we're seeing now amidst the pandemic?
Healthcare's changed. And I think that COVID-19 has done a couple of things. First of all, it's really brought the importance of making sure that people are safe, whether they're our own employees, when they go into a hospital, like our field engineers. We need to make sure that they have, the latest and greatest in terms of PPEs, safety protocols, the consistency of that. So really, really caring for patient safety and patients, clinicians, our own workers, I think is important. I also think one of the things that COVID-19 has done is it's increased the access to medicine. Where, the old school, I need to see my doctor, I'm going to get transportation, I'm going to go into the hospital and have that interchange face-to-face. I tell you, telemedicine has been widely accepted now through COVID-19. And I use personally my wife. My wife is a physician at Albert Einstein in the Bronx. And she told me before COVID, 90+% of her, her patient visits were face-to-face. And now during COVID, and I'm sure after COVID, it's the opposite. 90% of her, clinician or her patient visits are now telemedicine. So it's increased the access. Now where patients might not have had the ability to go into the hospital because of transportation difficulties or whatever, that telemedicine now increases the reach of caring for patients. And that's exciting. And again, plays very, very well to giving access to medicine for all patients.
Well, and that's a great segue into my next question. One of the topics of this event is equity. Healthcare technology is really exciting. We're seeing all kinds of breakthroughs, and just the science is incredible, as we've seen, especially during COVID. But then that does raise the question of, will everyone be able to access these new technologies? As a leader in the corporate sector, how do you think about this question of equity and how to address it?
Yeah, it's a passion of mine. Ever since I really got into healthcare, I really focus on, healthcare disparities. Somebody uses the term that, your healthcare depends on what zip code that you're in. And I think that everybody in healthcare has to be passionate to kind of take that away. My thing is, irrespective of which zip code you're in, you should get the highest quality of care. What I love about tools that make healthcare more digital, like the tools of Mural, like our command center, it not just makes healthcare available for those people that are in zip codes of really good health systems, but it allows us to reach out to the rural nature of patients where they are and give them that same quality of care. When I think of people that are maybe indigent patients that weren't able to have access to transportation to get into the hospital, telemedicine and other digital technologies will now give them the access to healthcare in their homes. And I think of GE. I think of GE really leaning into making more of our products more mobile, like our mobile X-ray and things that are attached to our mobile X-ray, or mobile ultrasounds or point-of-care ultrasounds, allows patients to get care, again, in a more mobile setting and not necessarily getting into a car, going into a health system that's in, urban America. And that's what I'm excited about COVID-19 accelerating innovation and about where GE plays.
So, you're talking about accelerating innovation and kind of speeding up trends that were already happening. When it's pretty tough to find some silver linings of a global pandemic like COVID. But when you think of a new technology that maybe wouldn't have existed at all had the pandemic not taken place, is there anything that GE is developing or has developed that it honestly can thank COVID for its existence?
Yeah, it is interesting to think of pandemic for innovation, but I think what it's done is it's increased the acceptance of innovation. And I think of GE, I think of something that we just launched recently, and COVID-19 has actually increased, people that are getting intubated. And I look at the 50 million patients that have either had COVID or will have, or that have COVID now or had COVID, about 2 to 7 million of those patients have to be intubated. And this critical care suite 2.0 that we have launched, GE has launched, has actually automated the process of how patients get intubated, I should say. And that's really important when you think of the productivity increases that we've had in this space, giving people more the importance of making sure that intubation is done for the right patient at the right time. To me, is where GE is at the forefront. So it's exciting. I hate to use pandemics as a way in which it's increased innovation, but Critical Care Suite 2.0 is a great example of that.
We got to find some silver linings from all.
Some silver lining is right. Is right.
So we have just about a minute left. We like to end our interviews with one fun thing. I am told that you are the father of some older children. So I would love to hear your take on how your family is celebrating Thanksgiving this year.
Caitlin, it's great. I have 3 daughters now, adult daughters. One is 24 who lives out in the Bay Area. A daughter is 23 who lives in Brooklyn. And my youngest daughter who's 20 who lives in Seattle. And since she is an athlete at the University of Washington, go Huskies, and she's right in the middle of her season, she can't travel back. So my wife and I last night sent her a nice little care package of ice cream and cookies and pound cakes, and just letting her know that we love her and we're with her. And our other 2 daughters will be joining us. And we're excited about that. We're going to have an old-fashioned, socially distanced Thanksgiving, stuffing ourselves with nice turkey and other things. But we're excited to see our girls because they are older and we don't get a chance to see them that much.
Well, Mom, if you're listening to this, I take care packages. So
Caitlin, send us your address. I see you're in DC, so we'll send you something nice.
Thanks. Yeah, you hear that, Mom? He's going to send me one. You better too. Anyways, Everett, thank you so much for joining us.
Caitlin, thanks for having me join. And listen, everybody be safe and take care of themselves, especially during the holidays.
Joining us now from Leesburg, Virginia is Deborah Atto, the president of Inova Loudoun Hospital. Welcome, Deborah.
Well, thank you. Thanks for having me.
Thanks for joining us. So one of the most prominent features, unfortunately, of the pandemic has been the racial inequities that have been exposed through it. And as a hospital president, can you just talk through a little bit what those inequities and disparities have looked like from your point of view?
Sure, absolutely. We were actually surprised a little bit when we saw the disproportionate share of people of color that were impacted by COVID-19, especially the death rate. Now, we've always heard about disparities of care, but to see it up front and center really did allow us to step back and take a look at some of the things that we do and ways that we can better reach all of our communities equally. So I think that was a good lesson for us.
And unfortunately, COVID is not something we can discuss in the past tense. It is very much ongoing right now, and the next few weeks and months could be very dark. So what have you learned over the last few months of all of this that you think we can apply to the weeks and months going forward to help address and reduce those inequities?
Sure. As we looked at this, and I'm sure many other industries have seen the same thing, the people who were front-facing, who were public-facing, the people who were first responders and first out of the gate, those were the ones who also were not allowed or did not have time really to take off. So when I think about one of the things that we could do, and that would be just paid leave, here's the reality. If you know that if you come to work ill, you will be paid. But if you stay home and you're ill, you will not be paid. And that's the difference between making a rent payment or keeping the lights on. And it's unlikely that you are going to let your employer know that you're not feeling well. So we need to really help to remove that barrier. Here's another reality for us. And I've heard a phrase that said, if you take care of the least of them, then you take care of all of us. If this person who has to come to work ill actually is the person who is taking care of your children, the person who is caring for your lawn, who's working in the grocery store or the cleaners, then that person comes to work ill and passes that along to all of us as consumers and users. So that's going to be really important for us. I think the other thing that we also learned, and this is not new information for us, but there are still pockets of communities that are untrusting of the healthcare system. And so when you get a pandemic and you look at this and you say, well, wait a minute, will I be treated equally? Will I be the experiment? Because some people still view it in that way. Or should I use a home remedy? So when people are thinking of that, they're also saying, should I actually access the healthcare system? So we need to make sure that we create trusting relationships. And what do trusting relationships look like? We need to be in your community. We need to actually pushes and pulls to get you in. We need to have people here who look like you. We need to make sure that we have people who speak the native language. So all of these are things that engender trust. And those are some of the things that we've learned that we need to continue to do. We need to be in your communities.
Well, and that's a good setup for my next question, which is one day this pandemic will be over, but what we have seen about the systemic inequities in our healthcare system, those aren't going away overnight. So what can you and your hospital, just even at a micro level, what can you do to start kind of unbaking some of these inequities from the system?
Sure. I think we need to really focus on the oppressed and the vulnerable among us. You know, when you think about sometimes profiling, and many times we use the phrase profiling in a negative way, there are some positives too that could come out of that. If we actually know the pockets of our community and the demographics of our community, then we know where we actually need to rifle resources. And I think that's information that's going to be important. We also should learn from other places. While we talk about inequities, the reality is inequities are not equitable. There are some communities that, yes, have pockets of inequity that fare much better than other communities. So what have we learned from that, and how can we mimic some of those things? A good example of something that we did, we learned that there was a period of time where many providers were not taking uninsured or underinsured women who were either pregnant or getting ready to deliver. And so Inova stepped in with Inova Cares clinics, and we actually positioned those clinics in pockets of communities most needed. And this allowed us to ensure that these women had the services that they needed. We do believe if you get a good start, you have a more likely opportunity to have a good ending. And so we placed those resources and those services there, A, with people who spoke the language, and B, with care providers who looked like the patient population that we were caring for. That was important. And we started to see much improvements in that patient population in that community. So I think there are a number of things that you can do in your own community to help remedy this.
Such good work you're doing with that for things, and I loved hearing about it. And I do want to move on to another topic that's really tough and been a kind of a very sad side effect of the pandemic. Is just this explosion of mental health issues within our community and across the country. Can you talk about what that's looked like in a hospital setting?
Sure. It's really unfortunate. I think that this whole time frame that we're living in has brought to the surface so many things. If you think about 2020 and all that we've experienced, so we've had a pandemic, we've had an economic crisis, we've had social injustice, we are looking at democracy in its core. There are so many things that even the most stable of us would be at least rocked by this, distracted by this. Now you take someone who already has a mental health issue or a mental health condition coupled with everything else that's going on. So what has happened with us, unfortunately, and it's across the nation, beds are full. And so it's been very difficult to access. And that's for an inpatient. But even for an outpatient, it's been difficult to access. Trying to get to a psychiatrist, trying to get to a counselor, the wait time is much longer than it should be and that we would like. And so people are in crisis and suffering at home, suffering in communities. You've got the child who has not been able to go to school. You've got the parent who is dealing with everything else that's going on within the family. You've got the person who's lost their job, who's lost their home. So this is something that is far-reaching and that will last far beyond the pandemic itself. So there are a number of ways that this is surfacing in our communities, and we're looking at ways to really address it.
Mm-hmm. Well, that is something that scares me is, the pandemic's going to go away, but mental health issues probably aren't. For example, if you're someone who has developed a substance abuse disorder during this time period, that doesn't go away just because the pandemic has. So my question for you is, knowing that we're going to have this wave of potentially long-term mental health issues facing us, what can providers do to change their ways and perhaps change their processes to help address that?
That's a great question. I mean, so much is promising when we think about a vaccine. We are hearing that at least 3 manufacturers are almost ready to go. And so the success rate should be very good. So at some point, we will address the physical component of the pandemic. The mental component will still linger. Think about this. Think about the person who has lost a loved one and was not able to be there with them. Think about the person who's lost that loved one and they were not able to really honor them in the way that they would have honored them in their passing. So there are so many things that will be far-reaching. The person who started a business from scratch and now they've lost that business. We need to address that. So one of the things that we do in healthcare is we do what we call an initial assessment anytime you come in. I think what we need to do within that initial assessment is to bake in a question really that says, how has 2020 impacted you? Physically, spiritually, mentally, emotionally, psychologically, financially? Because that first 15 or 20 minutes that you spend with the healthcare provider will allow us to address what you need to address. One of the questions that many of our providers ask when you come in is, what matters most to you? Because we want to make sure that we get to what matters most to you. Many times a patient waits until the last second when the doctor is getting ready to walk out to really express why they came in. So we want to start the conversation with, how has 2020 impacted you and what can we do to address it?
Love that. What great tip, I think. Just to end on a lighter note, we do like to end these interviews with one fun thing. And something I learned about you just from our conversation prior to the event is you have a really fun hobby that has worked very well with social distancing. Can you tell us about it?
Well, it depends. I have several that some haven't worked as well as others, but I do like fast cars, and I also like to drop the top. So that gives me the opportunity to really go out and escape, even though I'm safe and even though I'm isolated. But it gives me the opportunity to really open up. So I use that as my Zen time. And because many people are working from home, I can actually drive really fast in places that heretofore I was not able to do. So it's been great.
One silver lining of this year is open roads, huh?
You've got it. You've got it. And, and I haven't been stopped yet. So that's a plus.
Oh, well, good luck with that.
Right.
Deborah, thank you so much for joining us.
Thank you. It's really been a pleasure.
Thank you again to our audience, all of you who have joined us for today's event. We really hope that it made you smarter, faster. Thank you also to our sponsor, USA Facts. If you enjoyed this event, Axios is hosting another virtual event with USA Facts on December 18th. This one will look at immigration policy in the context of a public health crisis. As a reminder, you can always find the latest news at Axios.com and look at our dashboard there, or you can download the Axios app. Another reminder, if you would like to sign up for any of our newsletters, including mine, Axios Vitals, you can do that at signup.axios.com. Finally, and this is exciting, if you haven't heard yet, Axios is launching a new series of newsletters in cities across the U.S. To help you become smarter, faster about the areas that you live in. This will be called Axios Local, and you can find out more about it at axios.com/local. Again, thank you for joining us, and I hope you have a safe rest of your week.